pregnancy is not the only thing, that women struggle with, or not struggle with, or that women come across as a result of sexual activity. And I think in this whole liberal mindset when it comes to sexual activity and contraception, people have tended to forget that we're not only trying to prevent pregnancy, but that sexual activity comes with a lot of other risks, such as other diseases, STDs and so forth.
Hey, beautiful people. Welcome back to Divulge Talk Show. Welcome to a brand new season, and this is the first episode. My name is Mabandi, and today we're going to be talking about the effect of contraceptives on women. Now, contraceptives have been commonly used by women to prevent pregnancy. However, due to research, technology, they serve just more than one purpose. Some use it to treat menstruation cramps, stop or reduce ovulation, migraines, and so forth. And in this episode, I am joined by a health professional, and she's going to be taking us through and give us insight on what are the effects of contraceptives and what does it do to a woman in the long run. So, just to give you guys a quick introduction of my guest, who I'm very much excited about. Dr. Woniso Mazonde is a medical doctor by profession and holds a Bachelor of Medicine and a Bachelor of Surgery degree from Wits University. She's an academic author with an article published in the Journal of Obstetrics and Gynecology of India. She also holds a diploma in Bible Studies and Christian Leadership from Africa Multination for Christ College, South Africa. She is the host of the show Health and Wellness, which airs weekly on a Christian television channel called Ezekiel TV. Additionally, she describes herself as one who is romanticizing life. Welcome to the show.
Thank you so much. I'm so excited to be here today.
Zed. What do you mean by romanticizing life? Because I saw it on your Instagram. I was so curious. Like, what do you mean by that?
So I think for me, when I say I'm romanticizing life, it just means that I'm trying to really enjoy every moment and to make every moment special. I think sometimes in life we wait so much for these extraordinary moments and we are living for the grand gestures. We are living for, those once in a while moments. But I feel like you miss out on a lot of life that happens in between. So I'm all about making the simple things, the usually mundane things, really beautiful and really special, and trying to, maximize every moment in my life. I think it brings me a lot of joy, and it helps me to be content and to be at peace.
I think that's very important because, like you said, we always want to wait for the extraordinary moments, of which live every moment, every day, whatever that makes you happy. If it's food, if it's a hobby, I think that's important. So in today's conversation, I would like for us to focus on the sociological perspective and the biological perspective of contraceptives. And just before we delve into the conversation, I'd love for you to just to give us a broad understanding or a definition to describe what contraceptives are.
So essentially, when we talk about contraceptives, we're talking about either devices or medications, essentially interventions that prevent somebody from falling pregnant, that give some sort of barrier protection, or that regulate, a woman's hormones or menstrual cycle. So it's all about menstruation and how we regulate menstruation and how we stop menstruation.
Oh, okay, that's actually by devices. What do you mean by devices?
So I think a lot of the times when people hear the word contraception, they're often quick to think about, things like pills. You think about your combined oral contraceptives, like your triphasals and so forth. You think about pills.
Yeah.
When people aren't thinking about pills, they're thinking about injectables. So those are like your Depo-Proveras, your noestrones. But then we also have devices that we use as contraceptive measures. So those are what we call intrauterine devices. So those are like small little devices that we insert inside the cervix into the womb that prevent pregnancy. So there's some of them that are hormonal that will then release certain hormones into the body and prevent pregnancy in that way. And then others are just barrier protection, such as like the copper coil, where it kills sperm inside of the womb, and that's how it prevents pregnancy. So contraception is actually a really broad, and because of like modern technology and where it's taken us, we now have a lot more options for women other than just, you know, a pill or an injection. There's things like patches, there's things like there's also what we call an implanon, where it's like a small little device that looks like a pill, but it's not. It's like a little metal device that's inserted into the shoulder. So all of those are all devices that we use as contraceptive measures.
And how doesn't it affect the woman, especially now you mentioning that it's like, okay, when I'm thinking of the word device, I'm thinking of something, okay, made of metal. So how does the body respond to that now?
So you see, that is the beauty of modern medicine, that, you know, we have so much more at our disposal, and because of the amount of research and everything that's gone into contraceptives, we've found ways to make things that are still compatible, you know, with the human body. So for example, like the implanon that I was discussing, it's like a small little rod that gets inserted into the arm, make a tiny little nick on the skin, and it's inserted just below the skin. So it's not deep enough to, you know, cause any sort of systemic issues, but it's also nice for women because, you know, it's something you put in your arm and you forget about it for about like 3 to 5 years. It's not something that'll bother you, that you'll feel. It has very little side effects. So a lot of the medication, although of course there are some side effects, they are all made in a way in which they're compatible with the human body.
Okay, all right. And then my next question, I want to ask about how contraceptives affect our brains as women. For example, perhaps numbing the brain, because I saw on a Healthline website where researchers took brain structures of 72 people and they compared them, and then they realized that hormonal contraceptives do affect the emotional processing of the brain. So how does it affect us as women?
So I think, to be honest, when it comes to that topic of, you know, the effect of contraception on the brain, it's not one that's, you know, been researched a lot. So there are some research studies that have happened here and there, but there isn't really a consensus in the medical field as yet. However, what you're saying is correct to an extent, because essentially what most contraceptives do is they work on a hormonal level, on a biological level, and then they regulate your body's natural hormones, your luteinizing hormone, your progesterone, your estrogen, you know, those hormones. And essentially in a woman, those hormones are also play a really big part in sort of regulating emotions. That's why sort of a lot of people will notice changes that they have, even if they're not on contraceptives. You'll notice a change in your behavior or in your emotions throughout your menstrual cycle. How they sometimes, when you're a bit more tearful, more sad, other times when you're more tired and so forth. So all of those are because of the functions of the hormones that the body releases in different times of your menstrual cycle. So essentially when we give contraception, we are playing around with those hormones. So whatever function the hormones are that you're getting in that contraceptive pill will then obviously sort of accentuate whatever that hormone did on the brain. So because a lot of that was already emotional, that is how you end up seeing that sort of emotional side effects, I guess, of contraception.
Okay, I think it makes sense when you put it that way. You know, for someone who grew up in a country where teenage pregnancy is a thing, I mean, I remember in high school, like, kids would be pregnant, and obviously now in your head, you're just thinking, these kids are sexual active, they're still at school. And I want us to talk about the effects of these contraceptives on teenage girls. I mean, we're looking at the ages of 13 and 19, and research says that a woman's brain develops up to 25 years old. And then we look at things like cognitive abilities such as your attention and memory. How Now, okay, I don't know how to put this question, but then perhaps how do we deal with such? Or maybe is there a way we can prevent contraceptives being given to teenage girls? Because if you're still in school, you need attention, you need to memorize concepts in the curriculum at school. So how do we go about that when it comes to contraceptives affecting teenage girls?
Okay. I think, when you discuss this topic, it's really important to understand that teenage pregnancy is such a huge problem in our society, particularly in like sub-Saharan Africa. And then it's important to, take a moment to consider the reasons in which, we have such high rates of teenage pregnancy. That a lot of the times, particularly in like an African context, when we talk about teenage pregnancy, we often talk a lot about like power dynamics. We talk a lot about like gender-based violence, unfortunately.
Yeah.
There are a lot of, factors that play into, teenage pregnancy. And for the big part, contraception is something that we in the medical field actually promote in teenagers, because we have such a high rate of teenage pregnancy. Right. So taking away contraception for teenagers doesn't negate the fact that teenagers are still engaging in sexual activity, and doesn't negate the fact that teenagers will still, be engaging in other risky behaviors and falling pregnant. By taking away contraception, essentially you're taking away the only hope that we have of people staying in school, the only hope that we have of people, of young girls not falling pregnant. So that's why essentially in the medical field we're actually promoting the use of contraception, because contraception isn't the problem, sexual activity is. So if people are going to be sexually active, then we have to do the best that we can in making sure that people are not having unplanned pregnancies and so forth. And like I mentioned earlier, that in an African context, we've been seeing that a lot of the time when it comes to teenage pregnancy, there's a lot of, interplay between like power dynamics, between socioeconomic circumstances. In terms of gender-based violence, there are a lot of young girls that are molested, that are raped and so forth, which is a big part of teenage pregnancy. But then also, and this is more particularly in the broader African context, where you have a lot of times where young girls, that's the societal norm, where people are being given away in marriages very young, where children may not have access to, education and other things, and then end up falling into risky behaviors. So essentially that is the problem, and that is sort of the root cause of why we have so much teenage pregnancy. And contraception is sort of
a solution.
Yes, unfortunately. It ends up sort of being a solution for us to try and get those young kids, to stop falling pregnant. Because even what you mentioned in South Africa, I know like during the pandemic when we had COVID, we saw the rates of teenage pregnancy in Gauteng, even in our province, skyrocket. I think we got up to 28,000 teenage pregnancies that year, which is far higher than any other year, which shows that like there is a social aspect of it that we're not maybe really tackling as society. And, maybe if those people had access to contraception, we wouldn't have had that situation. But also, like you say, we can look at it in a medical perspective where we're just like, we want to give people contraception, but there is, I guess, a lot of other, religious, obviously something I'm passionate about, religious, spiritual, other aspects that influence, your teenage pregnancies. And other people might then argue that contraception being widely available to people perpetuates sexual activity in young people. So.
And in this case, that's the only solution, despite its effects. I just feel like you said, it's the root cause, so we just have to hand it over to them.
Yeah, because I think a lot of the time, we know that young people are engaging in sexual activity, and I guess maybe there hasn't really been a real solution for society in terms of, deterring young people.
Do you think there'll ever be a solution?
I don't know. I don't think so.
I also don't think so.
I don't think
so. Because I feel like it's been a problem since. It's just that now we are more advanced. Now we have technology. Now we have options. But when you look back and track back, it's just been an issue ever since. So I don't think there'll ever be a solution.
Absolutely. So the best that we can do is to make sure that, we give young people control over their bodies, and we also then, give them a way to, if they're going to engage in sexual activity, which is not something that I promote personally.
Yeah, I understand.
You know, if they're going to engage in sexual activity, let's give them a safe platform to do it, because there are a lot of complications that come with young people falling pregnant.
That's so true.
You know, a 12-year-old being pregnant, it has a lot of biological effects on them. It has a lot of psychological effects on them, even socially, in terms of the stigmatization that comes, you know, with teenage pregnancy and everything. So when we look at that, you know, we find that it's better for them to have had an outlet for safe sexual practice, rather than to sort of shun sexual activity altogether, knowing that people are already engaging.
Yeah, they're already engaging. Yeah. Okay, that makes so much sense. And I also understand that now women are more in control of their bodies because of contraceptives. I mean, back in the day, I don't think it was a thing. Women would just fall pregnant, and there wasn't any mechanisms or ideas about contraception. I mean, although it came in place in 1960, according to research. And do you think that it's good that women have now more control of their bodies, especially when we look at relationship dynamics? For example, let's say the man wants children, but the woman doesn't want. Do you think that's something you would say it's good?
I think so, yeah. I think, you know, historically, patriarchy has always been a thing.
Yeah.
Historically, women have often found themselves to be in positions where they're vulnerable, to be in positions, you know, where they're being oppressed, to be in positions where, you know, they're being abused. And, you know, contraception also then gives women, you know, like you're saying, control over their own bodies. Before, you know, that's why you used to have people having, you know, 8 to 10 children back then.
Sure,
you know, not necessarily because people wanted to have such really large families, but also because there was no other way, you know, to sort of prevent that. And especially if you're in a, you know, long-term relationship, if you're in a marriage and so forth, and you're engaging in regular sexual activity, pregnancy is something that's, for most people, is inevitable, you know, if there aren't any other, like, biological issues that are there. And that often, you know, it has a big impact on women. You know, we talk about the economic impact of it, you know, having multiple children, particularly even in this day economy, it's quite expensive.
It is, very.
You know, you look at just the cost of buying nappies and formulas and things like that, and then, you know, we look at the broader costs of education, housing, and so forth, that children come with a big financial cost. And for a lot of people, you know, women would end up being stuck in poverty because you have so many children that you're trying to take care of, that you can't bring yourself out of a certain situation. So, you know, there's all of those economic effects of having, like, multiple children, but even socially, where women were not really able to, you know, sometimes a lot of women had to stay at home, you know, to take care of families. And if you're having one child after the other and you're always, you know, nursing young children and so forth, it also sort of limits your own, you know, ability to do other things.
Exactly.
You know, maybe to go into the workplace or to go into business or so forth, because you have a lot of responsibilities. But I think essentially it comes down to what you're saying of just having autonomy over your own body, being able to control when something happens, and being able to be fully ready for it. Because I think a lot of the time people downplay how much, you know, emotionally and psychologically you need to be ready for pregnancy, and you need to be ready to have a child. I've seen a lot of women who come into the hospitals who deliver babies and then abandon them because they say that they're simply not ready for that, you know. So at least it gives women the power to then have children when they are ready for them. And that also helps the children of our generation to grow up in families where, you know, they are loved, where you have parents that are, you know, that are present and everything. So I think contraception in that regard has really been helpful in giving women that control and taking that power back for their bodies.
Okay. Yeah, that I think you've explained it even more, because at first I felt like probably it's a little bit unfair, especially for like men, but you explaining especially the psychological burden that it comes with, I think it makes much more sense. I think it's actually a really good thing. And there's one thing that I in particular felt like I need to ask you. As a doctor, I don't know how you see, because I was having a chat with a friend, and one of the things he mentioned was how contraceptives influence the way women are attracted to certain men. So, for example, whenever let's say a woman is on their menstrual cycle or on the pill, they tend to be more attracted to men that have a high testosterone and vice versa. So, for example, I'm on the pill, I meet someone, I'm attracted to him, and then if I get off the pill, I might not be attracted to him. Is that a thing?
Okay, so it's not that simple. I think a lot of the times when people talk about things like that, they're often referring to, certain, I'll call them hormones, but they're not really, things like pheromones that are, emitted by certain species. But most of the time when we're discussing that, we've seen it mostly amongst animal species. It's not really something that has been really proven, I think, where we have extensive studies on it amongst the human population. And I think there is a sense of attraction sort of being reliant on menstruation, but that's not necessarily dependent on contraception. Okay. So, for example, you'll find that a lot of women, when they're ovulating, will find that they're just more attracted to people, to men in general. But that's like a biological mechanism because, biologically speaking, the body is trying to encourage sexual activity, to encourage procreation and so forth. So you'd find that maybe during ovulation, people, may feel heightened attraction. But that's more of a menstrual cycle thing rather than a contraception thing. Yeah.
Oh, all right. So, moving to the next question, I want us to look at the pharmaceutical industry. Although now I feel like I don't know if I should ask it because you've answered most of the questions, sort of aligned to it. But do you feel as if they are knowledgeable about these types of contraception, or is it more now about capitalism and profit making? And I particularly put this question in because I was looking at like teenagers, how they just maybe give out, especially maybe the emergency contraceptives and stuff like that. And I was thinking, do they not consider the well-being of people, or is it now all about profits? And even when I was looking back at COVID-19, when it happened, how certain medications just being given, oh, use this, use that, and the pharmacist or the pharmaceutical industry was just like, yes, yes, yes. But was it really about, yes, this is good for you, or we need to make money because we don't know what's going on?
Okay. All right, so that's a pretty loaded question. I'll do my best to unpack it. I think when it comes to medicine and research, it's important to understand that, historically, even the medical field has always been very male-dominated and very patriarchal, right? Okay. So that stems down all the way even to research. When you look at the research in the medical field, in the early 1800s and so forth, it was mostly, studying the male form, studying the male body and so forth. So it was only recently when, the medical field started to advance and really start studying and putting research and time and effort into studying the female body. So I think there are still some gaps in knowledge in terms of the understanding of the anatomy and the physiology of the female form and how that's different to the male form, right? Yeah. So that's the first part. So already when we have medications, when we have drugs coming across, and this is across the board, not just with contraception, that sometimes there just isn't enough study in a particular population. This is also true, when we talk about, even certain racial groups, certain cultural groups, how certain medications and trials happen with only a specific population. Yeah. So it's sometimes difficult to then extrapolate that data and extrapolate, that analysis to other cultural groups, other races, and so forth. And that's often true when it comes even to women and contraception. However, that is something that's changing. Okay. There has been a lot of research that's been going into studying menstruation, studying contraception and the side effects. And, I often feel like the pharmaceutical companies are aware of a lot of the side effects and everything of contraception. It's just that people aren't. I've always used to make jokes with my friends in medical school how you look at drugs and, you always have that package insert that's inside medication that has a list of side effects. And those side effects and everything are there because, there's been research that's gone into it. The medical fraternity is aware of that. But I think people often don't take the time to read those
Yeah,
things
I'm
and to
one of
go through
them.
those things, that a lot of the time the information is there for people, and people don't, go through it as extensively. I've noticed it myself, even sometimes when I'm seeing patients and I'm counseling patients on like the different contraceptive methods, that, people sort of come in and they're set on one thing, and, they're listening for that thing, and you can say a lot of things, but people won't often retain that information. So I think it's really important that in as much as we've taken autonomy over our own bodies and having contraception, it's important to also take autonomy in your knowledge. Whatever medication, whatever contraception you're on, you should know as much as you can about it. Because I think a lot of the time information is there and it is widely available. When it comes to, capitalism and everything, when it comes to contraception, I mean, I think this one is a lot more of a subjective debate. Where I stand, I don't think it's, that it's as overt as it is in other industries, particularly in a South African context where, we're able to give out contraception to people free of charge in clinics and hospitals and so forth. And even just looking at the different options that women have, even within the public sector, I think there are a lot of things that are available for women and that are available at reasonable prices. Like I said, in the state sector where it's often free of charge completely, and that there are a lot of options available. Obviously, our private sector where, things cost a little bit more, they have things that are a bit fancier, things that have a little bit less side effects, but obviously will cost more. But I think it's not as big of an issue in terms of contraception as it would be in other countries and in other settings. Even in terms of when we talk about just how available even things like condoms are in South Africa, how you can go to university or any public building and be able to get, to get those. So I think in that way, the basic contraceptives are widely available and are reasonable. So I think people have really good access to that. I think the biggest hamper that we have to people's access to contraception is more the stigma that comes with it, rather than financial burden, really.
Can you give an example of the stigma that comes with it?
I think a lot of the time, and we see this particularly amongst younger women and amongst teenagers, that a lot of the time we'll see young people who are sexually active but feel ashamed to go and get contraceptives at clinics and at hospitals and so forth. And I think society, when it comes to the moral standards that society has, we've often talked about abstinence and, abstaining from sexual activity, which is something that personally I back 100%. And even, with my religious and spiritual background, it's something that I back 100%. But also, that's not everybody's truth, and that's not what everybody believes in. And a lot of the time we see young people are afraid to come and get contraceptives when they are sexually active because of how healthcare workers might treat them, because of how nurses might treat them. They sort of think that if they're coming to the clinic and getting contraception, everyone is going to know that they're sexually active. So there is still a lot of stigma in communities about like young people using contraception, and that I think that's one of the biggest things that prevent them from coming to get contraception, and not necessarily that it's not available for them.
How do you think we can reduce the stigma or just provide assurance to these young women that it's okay, I guess?
So I guess conversations like these, and there are also a lot of outreach programs that happen in schools and so forth, where people are given talks on contraception. I know that I've done a few as well, where I go to certain schools and give some talks on like not just contraception but more women's health. But I think education is really important, and also finding ways to mitigate those issues that teenagers have come up with. So even amongst healthcare workers, discussing for ourselves, putting aside our own biases when we see patients, so that patients don't feel like we're judging them or that they're being prejudiced by in any way. Finding ways to make sure the clinics run after hours, so that children are able, well, not children, but like teenagers are able to come maybe after school between there are other activities to come and get contraception. So things like that to just make it easier for teenagers who may be sexually active to then have access to contraception.
Okay. You mentioned something to do with young women going to get contraceptives and perhaps being not being treated well by a nurse. And how, since you're in the medical field, how have you guys sort of also communicated to the nurses and the doctors that might want to, bash the young women?
So I think there has been a lot of education and training even amongst healthcare workers, to sort of mitigate that and to have people be more aware of, their prejudice towards people when they see them for contraception. But also a lot of clinics and hospitals have dedicated teams now that work with contraception. So for example, if you go to a primary healthcare clinic, there'll be specific nurses that do family planning, and you go to that specific nurse that has had a little bit more training in it. And usually those patients like that don't even have to go through the entire clinic or the entire hospital. You go to a specific place. Even I know at the hospital where I work at, we have a designated women's health clinic, with professionals that are trained and passionate about that specifically, so that when patients see them, they see somebody that they can relate to, somebody who, is passionate about it, wants to see them, and has gone through all of the proper training, to treat them correctly.
Okay. All right. Okay, that makes sense. I think that's actually good because I think I have heard over the radio where young women complain, oh, I went there and then I was told, why are you doing this? And then for sure they feel embarrassed, and then now obviously it's going to lead to teenage pregnancy because they're not taking contraceptives. And the next, or I can call it a segment or sub-segment, I wanted to talk about sexual liberation. Is it a good thing that contraceptives have sort of brought sexual liberation? I don't know. And I know that you are more of a religious person, perhaps you are against it. But I know, when you watch podcasts, women are like, yes, I'm sexually liberated because at least I do not have to worry about falling pregnant or, being a single mother and all those kind of things. So is it a good or bad thing that contraceptives have brought sexual liberation?
Yeah. So I think you're right that I'd probably stand a little bit more conservative than other people.
Yeah.
But I think you are correct in a sense that a lot of the times, when it comes to sexual activity, that risk of pregnancy has always been the biggest risk to people, right? So having taken that away with correct use of contraception, then, people do feel a little bit more liberated. But I think sometimes that liberation is sort of taken advantage of, and that people don't fully educate themselves. Because even with that, when we talk about contraception and not falling pregnant, it's like I said, that it's only with the correct use of contraception that I think the idea that if I use contraception, I'm not going to fall pregnant does have its downfall, in that sometimes people are not using it correctly and then they don't see, those benefits. Or people, simple things like how if you're on a combined oral contraceptive and you're using antibiotics, it doesn't work. Simple things like that people aren't aware of, which then sort of maybe take away that liberation, or where that liberation sort of abuses that, and then we see those issues. But I think that my other issue with that is that pregnancy is not the only thing, that women struggle with, or not struggle with, or that women come across as a result of sexual activity. And I think in this whole liberal mindset when it comes to sexual activity and contraception, people have tended to forget that we're not only trying to prevent pregnancy, but that sexual activity comes with a lot of other risks, such as other diseases, STDs and so forth. And we've been seeing even in South Africa, when we talk about things like HIV and AIDS, it is still so rampant. It's just that it's not something that is as discussed anymore. And even particularly amongst young people, I think young people are under the assumption that if I'm on the pill and I'm not falling pregnant, then I'm okay. But the problem with that is then you engage in a lot of sexual activity and you engage in a lot of risky behavior. But pregnancy was not the only problem, because now we're seeing a lot of young people that are, testing positive for HIV all over again. We're seeing a lot of young people that are presenting, with AIDS, the sort of complication of HIV. We're seeing a lot of women that are struggling with infertility because of untreated sexually transmitted diseases. We're seeing a lot of people that are coming in with end-stage complications, of sexually transmitted diseases because we focus so much on the pregnancy that you forget that sex or any sort of sexual activity has a lot of other side effects. So I think, yes, people are a little bit more liberal in their sexuality because of contraception, but I do sometimes feel like it may be tending towards the extreme where people are forgetting now about all of the other issues that come with being sexually active.
Okay, yeah, that makes so much sense. And also I wanted to add on the exchange of energies. Like now when we look at the Christian side of it, the soul ties, and it goes beyond and beyond and beyond. But I guess not everyone is really thinking about it. Like you said, we just think about the pregnancy side of
absolutely. Because even just psychologically, I think there's a big psychological impact of that intimacy. And even if we're not talking about the spiritual aspect and we're not talking about the religious aspect, even just those bonds psychologically that you make with people, when you're being sexually active, all of those things are things that need to be taken into account. And I think I also just wouldn't be doing the viewers justice if I don't bring this up, that, when we talk about contraception, it's important to remember that contraception, prevents pregnancy. But there's only one thing that prevents disease, and that's condom use. And that a lot of the times people think, I'm on the pill, I'm on the IUD, I have an implant on. All of those things that we spend the rest of this, episode talking about only prevent pregnancy, but the only thing that prevents illness and disease, that prevents HIV, syphilis, gonorrhea, all of that, is abstinence and condom use.
Okay.
Everything else still puts you at risk, of contracting illness.
Yeah. Okay. So I'm a huge fan of like mental health for men. I always feel like whenever I have conversations, I always want to know, how does this affect men? I think having two brothers has made me be more softer towards men, I think so. So I want to know, how do, we spoke about the relationship dynamics earlier about, let's say the man wants a child and the woman is like, no, I have control over my body, I can't give you children. How do the use of contraceptives affect men? Be it in the short term or in the long term or in general, be it emotionally or mentally?
I think, when we talk about contraception, it's important to remember that, yes, there are also contraceptive mechanisms for men.
Okay.
Right? As much as we spent a lot of time talking about like women, men also have contraceptive mechanisms like vasectomies, and there's also a lot of research now coming up about pills and gels that men can use to, prevent pregnancy. But I think a lot of the time, like what happened in this episode, when we talk about contraception, it's often discussed as a women's topic, right? And yes, a lot of the time men may be wanting children, and that may have a role to play on them psychologically. But I think what contraception then brings up is the issue of consent, right?
Okay.
And of having a consensus in a relationship. Because before, that was taken away from women. If you engaged in sexual activity immediately, you were falling pregnant. But I think now it forces people to have discussions. It forces a man and a woman to sit down and discuss whether or not they want to have a child, and to reach a consensus where it's not just one person, who may be making decisions and another person sort of having to live out those decisions. So I understand that, sometimes men may want children, women may not want children. It may, create a rift. But I think it's also a really great opportunity to create dialogue in people, to create healthy conversations, conversations about consent, conversations to reach a consensus in relationships, where people can really weigh the pros and cons for each person in a relationship to see whether or not they are ready, both socially, psychologically, financially, to have children. And even biologically, because a lot of the time when it comes to pregnancy and having a child and everything, those are often things that affect the woman most, which is why it's so important for them to have the power. And yes, men can have, issues where, they want to be a father, they're ready to have children, and their partner isn't. But it allows us as a community and as a society to now have a dialogue about those issues, instead of sweeping them under the rug and sort of forcing pregnancies. Now we can deal with whatever issues people are having that may be preventing them or making them want to have children.
do you mind giving maybe a few examples of the men or male contraceptive?
So male contraceptive mechanisms, there are things that are like 100% that are long term. So things like a vasectomy, which is like a surgical procedure, in which we sort of operate on a part of the male reproductive organ to prevent, the release of sperm. And then there is also a lot of research at the moment into contraceptive gels and contraceptive pills for men, which will then prevent pregnancy, so lower sperm count, motility, things like that. But a lot of these things are still in the research phase and are still in clinical trials. But it is something that our viewers can be aware of and can look out for in the next few years.
And having said that, don't you feel like women taking contraceptives has given men the opportunity perhaps to just, how do I put it? Because I know that usually men settle down whenever they have the responsibility of fatherhood. So hasn't it given them the liberation of sleeping around? I don't know if that makes sense.
I don't. I guess perhaps to an extent, though. I don't really think so, because I think even with the statement that you made about like people then settling down when they have children, to be honest, in our society, that's not really the reality that we're seeing. I mean, especially in the sub-Saharan African context, we have a lot of households where children are growing up without fathers, where fathers are abandoning children. In fact, we are sort of really having what I would almost call a pandemic of the lack of fatherhood in families and in communities. And, a lot of fathers just not stepping up with their children. So I don't really think that the contraception has really liberated them. I think that one is a little bit deeper of an issue that needs to be delved into a little bit more. But perhaps you're right that maybe contraception does have a bit of a role to play in there.
Okay. Yeah. And do you think that it has also contributed to the reduction of marriages? Because I saw that in South Africa, Stats SA reports a 29.5 drop in civil marriages from 2013 to 2022. So I'm asking because obviously when people are using contraceptives, they kind of feel like I don't need to get married. I can still, because one of the reasons why people get married is obviously the sexual interaction, right? They feel like, you know what, I can just go around. So why get married? Why commit? Because either way, the women are not going to fall pregnant because of the knowledge we have about contraception and all those kind of things. Yeah.
I think when we're looking at marriages and people not engaging in marriage, it's a very multifaceted issue, and that there's a lot of things that play into that. I've seen people who have really strong marriages where both husband and wife are saying that they don't want to have children, and yet they have really great marriages. And I think also in our context socially, and maybe particularly in South Africa, it's quite widely accepted for people to be having, children outside of marriages. I mean, even when you look at social media and everything, you hear talk of like baby daddies and baby mommies being something that's, very normal, colloquially spoken now. It's very socially accepted. It's considered normal, which already shows you that people don't think that, having children force them to get married. But I think you're right in that historically that was the thing. That historically, if somebody fell pregnant, you were expected to get married and everything. And I think you are right in that it has maybe contributed to that. But how big that contribution is, I think that's often up. That's quite open to debate.
All right. Okay. And the emergency contraceptives, also known as the morning after pill, does it have the same effect as the regular contraceptives, considering that it works fast because you have to take it within a space of 72 hours? Yeah. So are its effects not stronger than the normal one?
So I think when we would have to then maybe delve into and define what we mean when we say are the effects stronger. Because I think, contraception, it depends on what type of contraception it is and how you use it and so forth, because there's a lot of different options that people have for emergency contraceptive. Yes, you have your oral pills like your levonorgestrels, but you also have other things like I spoke earlier about like intrauterine devices. We can insert a copper coil for somebody within 72 hours, and that can work as an emergency contraceptive, but it's also something that can still work as like a long-term contraceptive. So I don't think there's really increased risk in terms of side effects and everything when using an emergency contraceptive. I think when it's used correctly, the side effects will often sort of balance out with the use of long-term contraception as well. I think the issue with early pregnancy and sort of that idea of getting rid of pregnancy, that is what has a lot of, issues and complications and side effects, but not necessarily when we use the correct emergency contraceptives.
Yeah, I'm glad you mentioned getting rid of pregnancy. Is abortion, can it be regarded as a contraceptive?
I think that one's open for debate. I don't know if there is any consensus in the medical fraternity about that one. And I think that one is often, based on an individual's beliefs and their, spiritual, moral, whatnot background. But so that one I'm not really sure how I'd answer it.
Okay, all right. So I don't know if you have anything you would like for us to add on to the topic, because from my research and everything, I wanted us to talk about this is everything. I don't know if you have anything about the effects of contraceptives on women.
Yeah. I think really my take-home message to viewers is that you need to be aware of all of the options that are there. I think that, a lot of the time when we think about the side effects of contraception, we're only thinking about one thing. But there are so many different things that women can use for contraception, and things that are not as invasive. There's something as simple as putting a patch on your back, which is quite an effective contraceptive method. So I think when women are about to engage in contraception, it's so important to really sit down with your doctor or your nurse or your healthcare practitioner and really look at what all of your options are. Have knowledge on all of the different options, and then also do some research for yourself. Know what the side effects are of, medication. Know, what to look out for, what you can prevent for yourself. Because I think there's just so much knowledge that sometimes as healthcare workers, we may not relay it in the best way to people. Sometimes may give you pamphlets with 1,000 things to read up on. But I think that as women, we need to take control of our bodies, and that if I'm taking a pill or if I'm doing something every single day, I must be aware of the side effects. So I think for women to really educate themselves is the most important thing when it comes to contraception use. And that's how you can sort of circumvent a lot of the side effects of it. And I think the other take-home message from me would be, that at the end of the day, contraception is just to prevent pregnancy, and it only prevents pregnancy when it's used correctly. So you need to know how to use that contraceptive method and use it correctly in order to have the desired outcome. And that contraceptive use doesn't take away your risk of illness. It's so important that women understand that, contraception use doesn't negate getting sexually transmitted diseases, having the complications of that, the infertility, all of those things. And I think at the end of the day, now I'm stepping outside my shoes of, Woniso the doctor, but Woniso the person, and that for me, I think it's really important that viewers not engage in sexual activity until you're really ready, and that it's okay to abstain from sex, even in a society where it seems like everyone is doing and it's so socially acceptable. You don't have to do it. You can be different. If it's not something that you're ready for, if you're not ready, to be falling pregnant, if you're not ready to be intimate in that way with someone, it's okay not to engage in that. That even in the 21st century, in 2024, it's okay to wait for marriage. It's okay to live a little bit more conservatively, and it's also beneficial to your health.
Okay. I just had a question while you're speaking. Is it possible to take two different types at the same time of contraceptive?
So you can, So you can. There are certain contraceptives that are compatible together. The most obvious ones and basic ones being, using barrier methods, so like using condoms and then still using like an oral contraceptive or something like that. So you do have those, and then there are other times, for example, with women where we insert an intrauterine device and maybe they have bleeding, then we also put them on like an oral progesterone pill to sort of counteract the side effects of one or the other.
Yeah.
So sometimes you can take, but it's something that you need to discuss with your doctor, because if you do it yourself, sometimes you'll take one hormone that's cancelling one, and then you'll also take it in another one, and then sort of end up having no effects. So some contraceptives will cancel each other out, but some do work synergistically in terms of giving you a better outcome. But it's something that must be discussed with the healthcare practitioner.
Okay. All right. Thank you so much. I mean, I learned a lot. Like, I really learned a lot. Thank you so much for making time to come to the show. Thank you for giving us insight. And I hope you guys really enjoyed this conversation. Let us know in the comments, what do you think about the effects of contraceptives? You can share your journey regarding contraceptives. And yeah, don't forget to subscribe, like, tell a friend to tell a friend. And I'll see you guys next time, and goodbye.